Hi, everyone, and welcome to our webinar, Making Sense of Governor Newsom's 2026-27 May revision. I'm Ines Rosales, Outreach Strategist at the California Budget and Policy Center. And before we get started, I'm here to talk through some logistics to help everyone access and participate in this webinar. At the Budget Center, we're committed to ensuring more and new audiences can access our events. So beginning this year, the Budget Center is offering live Spanish interpretation for our educational webinars. To listen to today's event in Spanish, please click the globe icon at the bottom of your Zoom screen and select Spanish as your language option. Interpreting is simultaneous, so you must be on either the original audio or Spanish channel. En el Budget Center nos prometemos a garantizar que un público más amplio y diverso pueda acceder a nuestros eventos. Empezando este año, el Budget Center va a ofrecer interpretación simultánea en español para nuestros seminarios web educativos. Para escuchar el evento de hoy en español, haga clic en la imagen del globo en la parte inferior de la pantalla de Zoom y seleccione español como el idioma. La interpretación es simultánea, por lo que debe seleccionar el canal de audio original o el de español. We will have slides in Spanish posted on our website in the coming days, alongside recordings of this event in both English and Spanish. Additionally, we continue to offer live English captions, and you can access that by clicking on the CC button at the bottom of your Zoom screen. Lastly, because we want to have as many of you ask questions, we are carving out the last 25 minutes of the webinar for Q&A. So please use the Q&A function on your Zoom window to submit any questions throughout the presentation. I'll now pass it over to my colleague, Alyssa, to get us started with today's program.
Thank you, Inez. Welcome, everyone. I'm Alyssa Anderson. I'm the Policy Director at the Budget Center, and I will be your moderator for today. For those of you who are new to the Budget Center, we are a nonpartisan research and analysis organization working to create a just and equitable California where communities have the resources they need to thrive. For the next hour and change, we're going to walk you through the governor's revised budget proposal, the major policy changes, how these proposals do or do not address Californians' pressing needs, and we'll share some budget solutions that state leaders should consider as they make decisions during this fast-moving time in the budget process. We know a lot is at stake this year. Californians are facing persistent challenges on all sides: affordability pressures, federal attacks, and widening inequities. Almost 1 in 5 people in our state are experiencing poverty, while at the same time, large corporations have seen their profits soar over the past decade. So it's clear that we need a state budget that invests in communities and embodies the promise of a California for all. I would love for folks to take a moment, share in the chat with everyone, what is something the state budget should do to fulfill this promise of a California for all? And while you're doing that, I want to introduce my colleagues who will be joining me today. First off will be Budget Director Scott Graves, followed by Senior Policy Fellow Adriana Ramos Yamamoto, and Policy Analyst Nishi Nair. And during the Q&A portion, we're also going to be joined by Kayla Kitson, our tax policy expert, who's also a Senior Policy Fellow at the Budget Center. They're going to walk you through what's in the proposed budget, the big picture, as well as proposals related to health, economic security, childcare and early education, and housing and homelessness. Then we'll turn to answering your questions about the budget. Please remember to submit your questions in the Q&A function at the bottom of your Zoom screen. With that, I'm going to pass the virtual mic to Scott to walk through the big picture of the governor's proposed budget.
Thank you, Alyssa. So let's jump right in, starting with the Budget Center's top lines on the governor's May revision. On the bright side, the governor's revised budget reflects stronger than anticipated revenues and includes a couple of common sense revenue solutions. Having said that, we have some significant concerns with the governor's approach. He largely fails to protect communities from the harm of massive federal cuts required by H.R. 1, which President Trump signed into law last year. He makes it harder for Californians with low incomes to access basic supports. And he fails to propose more substantial ongoing revenue needed to protect vital services and respond to the growing needs of Californians. Let's turn now to some of the details, starting with the governor's very positive revenue forecast and what it means. The revised budget projects that general fund revenues will be almost $17 billion higher across the 3-year budget window compared to the January forecast. Just so everyone's aware, budget window is state budget jargon for the prior fiscal year, the current fiscal year that we're in right now, and the upcoming fiscal year that begins on July 1st. Obviously, more revenues are always a good thing, but we need to keep in mind that most of these revenues are already spoken for because of requirements put into California's Constitution by the voters. First, there's Proposition 98, which requires much of this revenue to go to K-14 education, which includes K-12 schools and community colleges. In fact, because of strong revenue growth over the past year, spending for K-14 education is up by over $6 billion since January and is up by over $20 billion since last June. Another chunk of the additional revenue identified by the governor will automatically be split between the state's rainy day fund and certain debt payments as required by Proposition 2 of 2014. The additional reserve deposit will bring the rainy day fund balance to around $15 billion next year under the governor's projections. Also, the governor uses the rest of these unanticipated revenues to help build a $10 billion cushion for the 2027-28 budget. That's the budget for the fiscal year that starts a little more than a year from now on July 1st, 2027. So now that I've clarified the revenue situation, let's turn to some of our major concerns with the governor's approach. Overall, the May revision fails to respond in a meaningful way to H.R. 1 and makes it harder for Californians with low incomes to access basic supports. We all know that Californians face many challenges today, including struggling with rising costs and facing the prospect of losing health care and food assistance. Given this reality, state leaders should do no harm. That is, they should not respond to these challenges by making it even harder for Californians to make ends meet. Unfortunately, as my colleagues will share in a few minutes, the governor's plan moves in the wrong direction across a number of policy areas, including childcare, healthcare, housing and homelessness, and supports for California's 58 counties, which are the backbone of our state's health and safety net programs. The governor says these counterproductive policy choices are necessary to help address California's budget challenges. But there's a big problem here. The governor is misdiagnosing the problem that our state is facing. California's budget challenges are real, but they're rooted in an outdated revenue system. To put it another way, California has a revenue problem. Current tax policies don't sustainably generate the revenue that's needed to keep up with the costs of maintaining services, to help mitigate the impact of the federal cuts that are already here and still coming, and to support the overdue investments that are needed to ensure that all Californians can make ends meet. In fact, most state spending growth since 2019 was just to keep up with rising costs like inflation in order to maintain existing services. Needless to say, addressing a revenue problem requires revenue solutions. Now, we do want to give the governor credit for advancing a couple of meaningful ideas to modernize California's tax system. Together, these proposals would raise over $1 billion in new revenue in the next fiscal year and $2 to $3 billion every year after that. I'm just going to hit the highlights of these proposals here, and we can come back to them in Q&A if you'd like more details. One proposal from the governor is to tax some currently untaxed software purchases made by businesses and individuals. This new sales tax would apply to software that's downloaded or accessed online. At a high level, we think this is a sensible step toward modernizing the state's tax system for an increasingly digital economy. The governor's second proposal is to permanently limit corporations' use of tax credits. The annual limit would be the greater of either $5 million or 50% of a corporation's tax bill before applying the credits. This proposal would reduce the number of corporations that pay next to nothing in corporate taxes in California, which is a huge problem. For example, as shown in this graphic, looking specifically at the yellow portion of each chart, well over 40% of profitable corporations pay only California's $800 minimum tax, $800, because they're able to use tax credits and other mechanisms to cut what they owe. Also, if we look at the roughly 340 corporations with profits above $100 million, we see, looking at the blue portions of this chart, that almost 1/4 of these 340 corporations used credits and other methods to cut their tax bills at least in half. And of those, around 20, represented in that light blue portion, were able to nearly zero out their tax bill. Permanently limiting corporations' ability to use tax credits, as the governor proposes, would go a long way toward addressing this problem. But despite these good proposals, additional revenue solutions are needed to meet Californians' growing needs and blunt the harms of federal cuts to healthcare and food assistance. Here's one idea. Stop giving corporate tax breaks a free ride. Tax breaks for corporations exist as part of the state's shadow budget, flying under the radar and rarely getting a second look. Corporate tax breaks should be evaluated every year, just like spending for childcare, healthcare, housing, and other critical services. Consistently evaluating corporate tax breaks can help to assess whether they're actually serving their intended purpose and inform options for longer-term changes to these tax breaks. Here's another idea. Close the water's edge corporate tax loophole, which I think many of you have heard we've been talking about a lot this year. This change would stop multinational corporations from using offshore tax havens like Bermuda to avoid paying California taxes. This would generate up to $3 billion per year to support services for California's communities. Now, these are just a couple of recommendations. If you have questions about other tax policy reforms or want to hear more, stick around for the Q&A. So, to sum up, we believe that state leaders must respond more boldly to the challenges that Californians are facing. It's true, as the governor likes to point out, that California's economy is one of the strongest in the world, but too many Californians are still being left behind. State leaders need to adopt bolder solutions to make corporate taxes more fair and raise significantly more revenue. And we know that they have options. The budget plan released by the state Senate last month, which includes substantial new revenues, shows that the governor's approach isn't the only way. The key question facing state leaders as they move toward finalizing the state budget is this: will California's prosperity be used to protect communities and reduce inequality, or will policymakers continue to prioritize corporate tax breaks over people's basic needs? We're just weeks away from finding out. And with that, I'll hand it over to my colleague Adriana, who will be reviewing the governor's health policy proposals.
Thank you, Scott. Healthcare is one of the most important parts of the budget because these decisions directly impact whether people can go to the doctor, fill a prescription, and go to the hospital when they're sick or injured without facing high medical costs or even medical debt. Unfortunately, as Scott noted earlier already, many of the proposals in the May revision move us farther away from the goal of providing health care for everyone. A little bit of context before diving in. Californians are already facing growing challenges accessing healthcare because of harmful federal policy changes, as well as state level cuts that policymakers made last year. And while the May revise takes a few steps to soften some of the damage, the governor's revised budget ultimately misses the mark because it reverses progress that the state has made over the past decade towards expanding access to care as well as supportive services. And I don't have enough time to unpack all of the health proposals in the budget, so I'm just going to focus on 5 areas, starting with major federal health policy changes reflected in the budget. And then I'm going to talk about some proposals that would specifically impact immigrants, seniors, and people with disabilities. I'm going to cover one bright spot in the budget on Covered California. And finally, I'm going to talk a little bit about provider tax updates because they have major implications for Medi-Cal funding. And starting with this slide here, the May revision reflects implementation of H.R. 1. This is the really harmful Republican mega bill that President Trump signed last year, and that includes deep cuts to Medicaid, the deepest cuts in U.S. history, and new restrictions that will make it harder for people to enroll in and maintain their Medi-Cal coverage. The administration projects that about 44,000 people will lose Medi-Cal coverage in this upcoming fiscal year, growing to roughly 1.3 million people by 2930 because of HR 1. And it's worth pointing out that many people could lose coverage even if they are still technically eligible, and that's because of paperwork burden or difficulties navigating the systems. The May revision begins implementing several of these federal changes, including this list that I want to highlight here. Work requirements, which will require certain adults to regularly prove that they're working, looking for work, or participating in things like job training programs in order to keep their coverage. We also see more frequent eligibility checks, which will essentially increase paperwork and administrative burdens that could cause many people to lose Medi-Cal, even if they still qualify, as well as reduced retroactive coverage, which just means that many people will receive less help paying for medical care that they received before applying for Medi-Cal. And I also want to mention that we have a resource on our website of a timeline of all of the different funding cuts to Medi-Cal, as well as CalFresh in California, that my wonderful colleagues Hannah Orbach-Mandel and Monica Saucedo put together. So I recommend you all take a look at that resource for more details. But these are basically the sorts of policy changes that are designed to kick people off of Medi-Cal. And for those people who are already balancing caregiving responsibilities or paid employment or stable housing, language barriers, these additional requirements can easily lead to delayed care or even loss of coverage. And lastly, I want to also highlight restrictions affecting immigrant eligibility, which will cause many immigrants with humanitarian status to lose access to federally funded Medicaid. And we'll talk more about immigrant communities on the next slide in terms of how the state is responding. So that's all of the federal changes. Thank you. Let's stay on this slide. The May revise includes harmful cuts targeting immigrant Californians specifically. The revised budget includes harmful proposals at a time when immigrant communities are already facing growing threats and instability because of this hostile federal immigration policies. So the first I want to highlight on this list is the governor proposes higher Medi-Cal premiums for certain immigrants ages 19 to 59, which would increase the monthly cost from $30 to $50 beginning in July 2027. This would make enrolling in Medi-Cal and maintaining Medi-Cal much more difficult to afford for these low-income communities who are already struggling with rising costs. And also want to point out that no other Medi-Cal member group would be subject to these premiums, and just in terms of how unjust these premiums are going to be. I also want to highlight that the state is choosing to apply HR 1 related work requirements to immigrants that are enrolled in state-funded Medi-Cal, even though there is no federal requirement to do that. And as I mentioned earlier, these work requirements create additional paperwork and reporting that could cause eligible people to lose coverage. And so that's a choice that the governor is trying to make here, and going even further and compounding the harm. And lastly, I touched on this in the earlier slide, but I want to bring it back to this proposal in HR 1 that would delay, or I'm sorry, that would end full scope Medicaid coverage for immigrants with humanitarian status. The governor proposes to delay this proposal, but ultimately still leave about 200,000 refugees, asylees, other vulnerable community members with only restricted scope Medi-Cal. And restricted scope Medi-Cal is emergency services or pregnancy related services. So this proposal would be particularly harmful for immigrant communities. I next want to highlight new barriers for seniors and people with disabilities. This is another one of the most concerning proposals in the revised budget. It's the reinstatement of the strict Medi-Cal asset limits beginning January 2027. This proposal would once again cap savings and assets at just $2,000 for individuals and $3,000 for couples. These limits effectively punish even modest savings and could force older adults and people with disabilities to spend down the little financial stability that they have just to maintain access to health coverage and long-term care services. The administration estimates that about 25,000 people would lose Medi-Cal in 2026-27 because of this change, and another 37,000 people would lose coverage the following year. And for many people, losing Medi-Cal doesn't just mean losing insurance. It can mean losing access to medications, home care, behavioral health services, and other supports that help people maintain or remain in their homes and communities. I also want to note that the budget includes cuts to in-home supportive services, which could reduce access to in-home care and backup caregivers that help seniors and people with disabilities remain in their homes and communities. And lastly, I want to mention that there is a proposal in the May revise to lower payment rate caps for PACE programs. This is the program of all-inclusive care of the elderly, which could make it harder for PACE providers to meet the complex health and social needs of older adults. Moving on to covered California, this is one area where the May revision does make an important investment. We know that many Californians who don't qualify for Medi-Cal still struggle with the cost of monthly premiums and out-of-pocket health expenses and turn to our state's marketplace for affordable coverage. The revised budget includes an additional $110 million to expand state premium subsidies for covered California enrollees with incomes up to 200% of the federal poverty level. And this builds on last year's investments in premium assistance and should help lower monthly costs for Californians who are already stretched thin financially. And lastly, moving on to this next slide, I want to briefly touch on provider tax updates because they are a major funding source for Medi-Cal and hospitals across California and major and impact the healthcare provider system in a major way. For the Managed Care Organization or MCO tax, the administration is proposing a new structure beginning in January 2027. The proposal specifically includes one component that's similar to the current tax and compliant with Proposition 35, which voters passed in 2024, and another component that's structured differently and not subject to Prop 35. But the administration estimates that the new structure would generate substantially less revenue than the current tax. And that matters because these revenues help fund Medi-Cal services and support the broader healthcare system that millions of Californians rely on. On the hospital fee side of things, federal approval is still pending for California's revised waiver request. The proposed hospital fee program is expected to provide billions in payments to hospitals, which is especially important for hospitals serving large numbers of Medi-Cal patients as well as uninsured Californians. At a time when more people may lose coverage because of federal policy changes, maintaining stable funding for hospitals and the Medi-Cal system will be critical. And before I pass it over to Nishi, I just want to emphasize that California does have choices here. The May revise outlines a number of harmful cuts, many of which would fall on Californians who are already facing great challenges accessing healthcare, including immigrants, older adults, people with disabilities, and people with behavioral health needs. But these cuts are not inevitable. As Scott mentioned earlier, we know that legislative leaders have already put forward alternative proposals that would better protect health coverage and supportive services while still helping address the state's fiscal challenges. And that's important because California has spent years expanding health coverage and building a stronger healthcare system. And this budget should build on that progress instead of reversing it. And at a time when federal policymakers are already undermining access to coverage and care, state leaders should be doing everything possible to protect people's ability to see a doctor, fill a prescription, receive behavioral health care, and thrive. And with that, I would now like to pass it over to my colleague, Nishi.
Thank you so much, Adriana. I think that we're about halfway through our presentation, so thank you all for sticking with us. I know a lot of this information can be really heavy, but we hope that we can make the process a little easier to understand through this presentation. And with that, there's a lot to cover in the economic security space. So I want to start by talking about some of the proposals and some of the programs that were maintained in the May revision. So there were multiple programs that were maintained and had maintained funding in the May revise. That includes programs like CalWorks and state refundable tax credits and the SSI SSP program. And we also saw that CalWorks had a moderate grant increase that was mandated by prior legislation. And I want to highlight here that while the maintenance of these programs is so vital in and of itself, the impending federal threats, affordability crises, and other situational factors are making it increasingly difficult for many Californians to make ends meet. So maintenance of just programs is not going to be enough. In addition, we also saw the commitment to expanding the California Food Assistance Program, or CFAP, also be maintained and is slated to take place in October 2027. The expansion will broaden the reach of the program by including all income-eligible Californians ages 55 and up in the program. And this would include undocumented Californians. And while this is a commendable first step and the expansion of the program will allow millions of new Californians to access food benefits, we also know that under HR 1, many new people will become newly ineligible or face new barriers that will jeopardize some or all of their food benefits. For example, Californians with humanitarian immigration statuses are slated to be ineligible for CalFresh later this year, and many people will be newly subject to CalFresh time limits and at risk of losing some or all of their benefits. However, the administration does not outline a plan via CFAP or otherwise to ensure that these individuals can still receive the support that they need. And like I mentioned earlier, across the board, maintaining current programs alone will not adequately protect Californians. The state needs significant and sustained program investments to ensure that families achieve long-term economic security. And I think you've heard this before, but you'll hear us say it time and again, because it's so true that this will require raising new and sustainable progressive revenues to recover from years of underfunding that many of these programs have seen, and in order to build a stronger safety net for the future. And with that, I want to move on to talking about some of the particularly harmful proposals that we saw in the May revise, starting with proposals that specifically impact older adults and Californians with disabilities. As we saw that in the May revise, there were multiple cuts to core programs that serve these populations. Some of these cuts were touched on earlier in the health section by Adriana, so I don't want to spend too much time getting in the weeds on these points, but just want to reiterate that the changes to IHSS, including changing the asset limit from $130,000 to just $2,000 for an individual, shifting IHSS costs to counties, and eliminating the backup provider system, all will impact the ability of recipients to receive the care that they deserve. In addition, many harmful changes to Medi-Cal, like raising monthly premiums and denying full scope coverage to undocumented adults, will specifically harm older immigrants in California. The proposal would also, like Adriana said earlier, enforce a lower cap rate for PACE programs. And just as a reminder, the PACE model of care allows older adults to receive specialized care to best meet their needs. And so cuts to this program could force recipients into more fragmented systems of care overall and lower the quality of care that they're receiving. In addition, we're seeing $70 million in reductions to the Adult Protective Services program due to the elimination of an expansion that was approved in the 2021 Budget Act. Under the expansion, everyone ages 60 and up could receive APS, but now only those ages 65 and up will be able to access these services. And in addition to the age limit, we also see that the expansion will not just change the age eligibility, but will also eliminate wraparound services like long-term case management and connection to housing and homelessness supports that will be eliminated not just for the new ages that will be excluded from the program, but for all APS recipients. And I want to pause just to highlight how much harm in the May revise is targeted at older adults and Californians with disabilities. Recent California poverty measure data show that basic needs programs are vital to reducing poverty, especially among older adults, which is why these compounding cuts across issue areas are especially harmful to these communities who often already face increased barriers to securing everyday basic needs. All right, so then I want to move to talking about certain proposals that are impacting food assistance. We saw that there was $30 million in one-time funding to support local food banks. And while the $30 million allocated to food banks is an augmentation to the baseline $8 million for Cal Food that they usually receive, it's still way less than what the program has previously received, which is about $60 million, essentially making this investment a cut for food banks. And we know that food banks will be, and in some cases already are, overburdened due to people relying on them as they lose their CalFresh benefits, making this investment especially crucial right now. In contrast, we saw that the Senate's plan included $100 million for CalFood, recognizing the important role that food banks play in supporting all communities across California. In addition, we saw that there was $30 million in one-time funding for counties to support additional workload due to CalFresh changes via HR 1. While this is a step in the right direction, the $30 million is less than 1/3 of what counties have cited as anticipate spending on the implementation of CalFresh in the 2026-27 fiscal year. So not nearly enough for what counties are going to need. And I want to point out that across both CalFresh and Medi-Cal, county employees are the ones in charge of administrating and connecting individuals to these services, making investments in the workforce at the county level critical. Because of HR 1, counties will need substantial support from the state, without which local agencies and county organizations will become even more burdened than they already are, making it harder to administer these programs to the millions of individuals that rely on them. All right, and I want to close out by talking about covering some key takeaways from the childcare space, starting with the failed promise of the 44,000 spaces for childcare. In 2021, the administration made a promise to expand childcare space expansion, but this was delayed and paused. Then in 2024 trailer bill language, the governor promised the remaining 44,000 new spaces that would be provided in 2026-27. However, this did not materialize in the May revise. And I want to point out that in the Senate's budget plan, they do fund the promised 44,000 spaces, and they do so by right-sizing the California State Preschool Program and moving community-based state preschool to be under Proposition 98. This would in turn free up general fund dollars that could then be used to fund the 44,000 spaces. And on top of this, we're also seeing almost $70 million in cuts to the funding for the alternative payment program and over $2 million worth of cuts to general child care program funding, which would together further eliminate almost 7,000 additional child care slots on top of the 44,000 spaces that we're not seeing be fulfilled. A critical part of expanding childcare slots is also to have a stable childcare workforce. However, the revised budget does not make clear progress on improving pay for providers. At current rates, providers are being paid well below the true cost of care, and the lack of clarity on the timeline for implementing a more fair rate structure continues to destabilize the childcare system. And instead of trying to improve pay for providers, the May revise undercuts progress on fair pay by first reducing the cost of living adjustment or COLA to 2.01%, even though it's statutorily required for the COLA to be 2.87%. They also walk back the prospective pay for providers, which would allow providers to be paid on or before the service is provided, which would offer more financial stability for childcare providers. Across the board in the economic security and other issue areas, we see that Californians are facing a multitude of barriers to security. HR1 is gutting core services. Essentially, no job growth is expected in the coming years, and the cost of everyday necessities is rapidly increasing. Now more than ever, the state needs to help ensure economic security for all Californians, which necessitates stronger and more sustainable revenue solutions as well. And with that, I'm going to pass it back to Adriana to close us out with housing and homelessness.
Thank you, Nishi. And I just want to note that I'm seeing a lot of really good questions coming in, and we're really eager to get to your questions. But before that, I want to talk about housing and homelessness. This is another really important area of the budget because it directly impacts if people have access to a safe, stable, and affordable home that is foundational to living a healthy and prosperous life. We know that California has both the resources and the responsibility to ensure that everyone has a stable, dignified place to call home. And yet, the May revise fails to meet the moment for California renters, people experiencing homelessness, and low-income families that are in need of affordable housing amidst the state's ongoing affordability crisis. So let's take a look at the proposals impacting renters. The governor May revise does little to address housing stability needs for renters or strengthen protections for those at risk of losing their homes. Specifically, the revised budget does not include funding for the expanded renters tax credit that was included in last year's Budget Act. It also doesn't provide any additional support for renters who are displaced by disasters, including the 2025 LA wildfires, even though there was some funding proposed for homeowners. And lastly, it does not include any new investments targeted for eviction legal defense or the Judicial Homelessness Prevention Program, even though formal evictions in California has surpassed pre-pandemic levels. Next, I want to talk more about homelessness. The May revise maintains its stance on not including any new or ongoing funding to address homelessness. There is $500 million for round 7 of the Homelessness Housing Assistance and Prevention Grant Program, or HAP, in this upcoming fiscal year, but this is half of the amount of previous rounds of the program has received, which means that service providers that receive these dollars will have half the resources to carry out their work. And that's going to lead to drastic reduced homelessness services for people. And on top of that, HAP round 7 will require additional accountability measures that will be challenging for localities to meet. I also want to note that there are cuts for the Bringing Families Home program, the Home Safe program, and the Housing and Disability Advocacy programs. And specifically, the Bringing Families Home program and Home Safe are expected to sunset soon without additional funding, despite strong evidence that they are really effective in supporting people, especially vulnerable families, older adults, and people with disabilities. And one important point that I want to make is that California can't streamline or mandate its way out of the housing shortage. Adding things like more red tape to homelessness funding without increasing resources will not solve the problem. It will only make it harder to help people. Accountability and coordination matters, but it is not a substitute for sustained investments and policies that keep Californians housed and avoid shifting impossible trade-offs onto communities. Next, I want to touch on affordable housing. The governor proposes 0 new state dollars for affordable housing, continuing a years-long decline in investment as needs grow and federal supports decline. The administration points to the new California Housing and Homelessness Agency as its answer to the housing crisis. However, reorganization is not a housing plan. I also want to note that the May revise is silent on CARB's proposed cap and invest regulations, which would essentially zero out funding for the Affordable Housing and Sustainable Communities program. And this is a program that the administration and the legislature restructured just last year to provide more cap and invest funds for affordable housing. And lastly, I want to note that the proposed permanent business tax credit cap would include the state low-income housing tax credit, threatening one of the last critical financing tools for affordable housing development. And before I turn it over to Q&A, I just want to say that we do see some bright spots in legislative leaders' plans that include more support for homelessness and affordable housing. Specifically, the Senate's budget priorities offers a stark contrast in budget values, as their proposal includes, for example, $1 billion for affordable housing programs, including the multifamily housing program and the state low-income housing tax credits, and $1 billion for home ownership programs, which is great to see. Just to provide a few examples, so the governor and the legislature should work together to ensure that people have the resources that they need to maintain access to safe and stable homes. And ultimately, adopting fair and sustainable revenue solutions is essential to protecting Californians and to funding the solutions needed to continue addressing housing affordability, preventing homelessness, and reducing poverty statewide. And with that, I will pass it over to my colleague, Alyssa, to kick us off for Q&A.
Great. Thank you so much. Really want to thank my colleagues for their very helpful walkthrough of the key budget proposals, and want to thank all of you for being here and engaging in this important conversation. So we are going to transition now to answering your questions about the May revision, and we've gotten a lot so far, so we're really excited to dive in. If you have additional questions, please go ahead and use the Q&A function on your Zoom window and keep those questions coming. We're going to do our best to try to answer as many as we can. And just briefly, before we transition to questions, I just want to share a little bit about next steps in the budget process because we've gotten some questions about that. So we are in the fastest moving phase of the budget process, and the legislature really only has 3 weeks to agree to their legislative budget plan and draft their budget bill that they then have to pass by the June 15th constitutional deadline. But remember, that won't be the final budget. What they pass on June 15th isn't the final budget. They still need to continue negotiations with the governor to arrive at a final deal. So that will continue to happen in mid to late June. But the key thing to remember is that budget decisions will be made very quickly in the coming days and weeks. So there is absolutely still much opportunity to influence. But you want to share your take on these proposals as quickly as possible. And particularly target the legislature as they are considering the governor's proposals that he just put out. So I'm going to turn to questions now, and we have our panelists as well as Kayla Kitson joining us here because we've gotten a lot of questions about revenue. And so I actually want to start with that. And so Kayla, Scott mentioned at the top of his presentation that the governor's budget does include some common sense proposals on revenue, but it just doesn't go far enough. And so I think, first of all, I would love for you to share a little bit about additional opportunities that the state has to raise revenues.
Yeah, great question. Thank you so much. So I want to reiterate that the proposed credit cap that the governor proposed is a really important strategy to make sure that the most profitable corporations aren't paying basically nothing in state taxes. I would note that compared to our current temporary credit cap, which is set at $5 million per corporation per year, the proposed permanent credit actually gives the most profitable corporations a little bit more opportunity to avoid taxes since they can cut their tax bill by up to half if that's higher than 5 million. So the state could raise more revenue by setting that percentage lower. For example, saying like you can't cut more than 25, quarter of your tax liability. Just that's an example. There's no, magic number. And then another point that's related to that credit cap is that when lawmakers put this temporary credit cap in effect a few years ago, they also agreed to give refunds to corporations for the credits that were limited during this time period. And that's expected to cost the state almost $7 billion over the course of several years, but having some impact in the current budget window. So in line with this current permanent cap, they could consider not providing those refunds since those will have a significant budget impact. And then I also just want to note, Scott mentioned this earlier, but repealing the Water's Edge election is really a critical complementary policy to the credit cap because they both get at different ways that corporations can avoid taxes. So I want to make sure they're not seen as alternatives. They really are. They should be seen as two ways to target the biggest way that corporations avoid taxes. And I'll leave it at that for now. But there are plenty of other things that state leaders could do that would be bolder than what's currently proposed.
Thanks so much, Kayla. Yeah, and I'm seeing in the chat, this was rough to listen to. Absolutely. And so I think it's important, to keep in mind that these additional cuts in the governor's revised budget, those were policy choices. The failure to meaningfully respond to federal cuts is a policy choice. And there are alternative choices and ways to protect vital services. And it really begins with making sure that large profitable corporations are paying their fair share. And so related to that, I'm going to stay with you for a minute, Kayla, because we've got a lot of questions about revenue. Can you share, are there successful examples of other states or countries that have closed the Water's Edge tax loophole? And how much revenue did that actually generate? Or can it generate here?
Yeah, it's a good question. And I didn't mention earlier that it's estimated that it could generate around $3 billion a year. So we actually didn't used to have the Water's Edge election. It was put into place in the 80s. So California and other states didn't have this option. Basically, corporations had to look at their worldwide profits. And then in the 80s, California and other states created this election. And we currently allow corporations to choose which method they want to use. So some corporations are already filing by looking at their worldwide profits. And so our tax administrators know how to do this. It's not a difficult change. So hopefully that's helpful. And in terms of other countries, because other countries' tax systems work a little bit different, there's not an exact parallel.
Okay, great. And one last question, I'm going to stay with you. How many of these high earning corporations would leave if their taxes were increased?
It's a great question that comes up a lot. When it comes to corporate taxes, the way that states, that California and other states calculate how much of a corporation's profits are taxed in a given state is by looking at their share of sales that they make in the state. So if a corporation makes 10% of its sales in California, we tax 10% of its profits. So it really has nothing to do with where they're located, where their headquarters is, where their workers are. So a corporation moving their headquarters to Texas, for example, does not save them on California taxes, assuming they're still availing themselves of our entire, our huge market of customers. So I think that's kind of a scare tactic that folks use, saying that corporations will leave the state.
Great, thank you. Really great questions on revenues. I'm going to switch over to health because we have a lot of health related questions. So first of all, appreciation for Adriana sharing the projected number of people who will lose Medi-Cal, and the question about what's the most recent number of Californians enrolled in Medi-Cal?
Yeah, that's a good question. Thank you for asking it. I believe that's about 14.3 million people. That's over a third of the state's population, so 1 in 3 Californians. And there's actually a really helpful resource on the State Department of Healthcare Service website. I think it's called Medi-Cal Fast Facts, where you can take a look at how enrollment is changing. But just really underscores the importance that this program plays in terms of keeping people healthy, as well as supporting jobs, businesses, and the broader economy.
Absolutely. Thanks, Adriana. And then staying with you, is the new $110 for covered California subsidies enough to cover the skyrocketing premiums due to HR1?
That's another really great question. Just to provide a little bit of context here in case people haven't been following, we know that over 1.9 million Californians rely on Covered California for their health coverage. And we've seen healthcare costs increase for many people, especially after federal policymakers let the enhanced federal premium tax credits expire. This is something that really helped a lot of people afford coverage. And as costs increased, some enrollees did shift to lower premium plans with higher deductibles and out-of-pocket costs in order to keep their coverage. So to your question on if is this enough, we would say it's not, but it does support people at the lower income spectrum who are relying on Covered California for that affordability assistance. But we really should encourage federal policymakers to restore these enhanced premium tax credits to help keep health coverage affordable at a time when so many are already struggling with really high health care costs. And the state could also pursue some strategies to improve access to affordable coverage through Covered California. So to recap, it is a really helpful resource for folks, but there's always more that we can do to make sure that people can afford health coverage.
Great, thanks so much, Adriana. And now I'm seeing a lot of questions related to counties, so I'm going to switch gears. One is, what proportion of the May revise impacts budgets to counties and hospitals in comparison to impacts to initiatives like grants to CBOs? Oh, sorry, I thought Scott, maybe that was a question for you. Okay, we're gonna get back to the person who asked that question. Apologies. Another county related question. How is the state budget supporting counties as they struggle to reanimate and ideally improve upon their indigent health programs that were mostly mothballed in the wake of ACA, in the ACA? Scott, do you want to take that one?
Yeah, this one I will take. This is kind of an easy one, sadly easy because really the governor's May revision does nothing to help counties in this regard. A lot of people who are going to fall off Medi-Cal because of burdensome red tape are going to show up at counties' doors. Counties are healthcare providers of last resort by state law throughout California. And a major funding source that they used to use to provide what's called indigent healthcare was eliminated over a decade ago with California's implementation of the Affordable Care Act. And counties, as we know, are very revenue constrained. They can't handle this influx on their own. So they're going to need the state to step up. And the governor's answer in his May revision is essentially, you're on your own, at least as far as, parsing the numbers. So counties are definitely going to be in there arguing for more. I think right now they're asking for over $500 million as part of the next 2 fiscal years to help them address the needs around indigent healthcare. That's just for indigent healthcare. Obviously, they're going to be asking the state for additional funding related to other HR1 impacts. So it's really imperative for the state to step up here and help counties help Californians who are in need and threatened with losing healthcare coverage because of HR1.
Thanks, Scott. And very much related to that, so we know that HR1 creates new administrative responsibilities, particularly in healthcare with the new work reporting requirements and Medi-Cal renewals. How much funding was provided in the May revision to implement HR1, and is that funding sufficient for the workload that counties are facing?
Adriana, do you want me to jump in on this one or?
Sure, yeah. There was some funding provided in the May revise for counties to start implementing HR1 related requirements. I believe it was 262 million in 2026-27, and that's 74 million general fund dollars, and 333 million annually in 2027 and 2028 to support increased county workload associated with all of the different federal changes that are included in HR1. I do want to note one important point, though, which is that we've heard counties indicate that they will need significantly more funding to administer all of these new requirements effectively. And in order to help prevent people, especially those who are still eligible, from losing Medi-Cal coverage due to the new paperwork burdens and administrative barriers like the increased eligibility checks and the work requirements, and reduced retroactive Medi-Cal coverage. And one other point that I want to make is that counties have also requested substantial additional support to address the broader impacts of the broader HR1 impacts, like Scott said, on things like county indigent care programs, public hospitals, behavioral health systems that are going to be overwhelmed because of HR1.
Great. Thanks, Adriana. And please keep your questions coming. We still have quite a lot, but would love to take more. And if we don't get to all of them, we will follow up with you afterwards. So we have a question here about behavioral health. So Adriana, I want to come back to you. Could you please explain how the funding from the Behavioral Health Services Act is proposed to be used?
Yeah, this is another really good question, and unfortunately didn't have time to cover behavioral health updates in the presentation. But just want to provide a little bit of context before trying to answer this really important question. We know that policymakers have made significant investments in behavioral health systems in the past years, and the May revise largely maintains these initiatives, including the Children and Youth Behavioral Initiative, the Behavioral Health Bridge Housing Program, the infrastructure program, and things like mobile crisis response. But it does rely pretty heavily on non-general fund sources in the May revise, and does shift some future costs to counties. And that's also coming at a time when federal cuts and threats to behavioral health waivers are creating some uncertainty for the long-term stability of of California's behavioral health system. So one area that I want to highlight in terms of this cost shift or use of dollars is around Prop 1 implementation. Prop 1 is the ballot initiative that was passed in 2024 that amended the California Mental Health Services Act and authorized a bond for behavioral health treatment residential facilities. And so the May revise proposes funding to continue Prop 1 implementation, and there is a change regarding state-directed activities. So specifically, 174.8 million for the Department of Public Health, 131.3 million for the Department of Healthcare Access and Information, and 10 million for the Commission for Behavioral Health. And one change that I want to point out here is that the May revise relies on the Behavioral Health Services Fund in place of the general fund for these state-directed activities, which is mostly for health prevention and workforce programs. So it relies on the BHSF, the Behavioral Health Services Fund, in place for a general fund, which and the May revise also specifies the shift. So it's 211.9 million in 2026-27 as this cost shift. And one other thing that I do want to point out is that because of the implementation of Prop 1 in general, more counties have expressed that they are having to use less resources for things like prevention, early intervention programs to help address behavioral health needs in their communities. So clearly, this is another area where more funding is needed, more sustainable ongoing revenues are needed to make sure that counties can meet the demand for behavioral health services in their communities.
Thank you so much, first of all, for that great question and for the really great response, Adriana. I have such a wealth of knowledge on all health-related policies. I'm going to go now to Nishi and bring you in here. We have a question. Do you know what the budget impact of the CalFresh work requirements will be? Are we expecting a lot of savings because of the number of people who are expected to lose the benefit? And do we know how many people?
Yeah, happy to answer. I don't have the specific numbers of people off the top of my head, but we know that the January proposal included about $119 million more in state funding in CalFresh administration than in the May revise. And the number is so much lower in the May revise because of the projected decline in caseload. So we do know that CDSS is projecting that there's going to be decreased caseload and therefore allocating less money for CalFresh administration. And I can follow up with more specific numbers on the number of people. I don't have them off the top of my head. But yes, we do know that the state is projecting savings, but it always feels funny for me to think to call something a saving when it means that millions of people are losing a benefit and therefore producing what's called a saving. So even though it is somewhat of a saving, we know that it's going to result in counties receiving less money to administer CalFresh, and that millions of people are going to be kicked off the program. And that number is not specifically just due to CalFresh work requirements. But we do know that work requirements are likely to push people off of the program.
Yeah, absolutely. Thank you, Nishi. I'm going to come back to you, Scott. This is another issue we didn't talk about, corrections, justice system, and we have a great question here about, given the structural deficit, federal cuts, LEO's recommendation to close additional prisons, should prison closure be treated as a more serious budget solution this year and not just a long-term justice reform goal?
Yes, it absolutely should be treated more seriously. It should have been in the governor's May revision, and it is a shame that it wasn't. The Legislative Analyst's Office has reported for years that California has an excess of prison capacity. And while the state has been whittling down that capacity over years, over the last few years, there's still more space that can be reduced. And that unfortunately did not make it into the governor's May revision. The governor is taking his foot off the gas pedal when it comes to downsizing the prison system. And we think that state leaders should be doing more. The only thing I want to point out, though, is we are so close to the start of the next fiscal year that it's unlikely that even if they did decide as part of their final negotiations to close one more state prison, it's unlikely that prison closure would happen soon enough for them to score the savings in the 26-27 fiscal year. So there would be state savings eventually. They probably just wouldn't show up in the year that's about to start on July 1st. It would be more of a 27-28 saving. So yeah, so that is a direction they should be moving in. Can't necessarily say that they'd be able to score savings in the upcoming budget year.
Thanks, Scott. That's super helpful. And I know you know this because we talked about this recently. I think you had a figure of how much savings there would be, a full year savings for each prison closure. Was it 100 million? Am I
Yeah,
remembering
well,
that
the
correctly?
LAO reports around 150 million in ongoing annual state general fund savings. But the other thing to keep in mind is that some of these prisons are really decrepit. And if we keep them open, we have to spend hundreds of millions of dollars on infrastructure just to keep them going, make them habitable, avoid lawsuits, all that stuff. So by closing a prison, you're not only saving the annual operating costs ongoing, you're also saving a big chunk of money that you would otherwise have to sink into that facility just to get it up to habitable standards.
Yeah, it's such an important point. Okay, thank you. I'm going to come back to revenues here and bring Kayla in. We had a couple questions about Prop 13. So is that an option, especially for corporate profits? And then could you talk a bit more about Prop 13 and its effect on revenue, particularly related to corporate profits? I mean, property, excuse me.
Yeah, thanks. This is a really good question. Folks probably remember in 2020, there was a ballot measure that would have focused on business properties and made sure that they were taxed based on their current market value as opposed to being taxed on whatever they bought the property for, which could have been in the 70s or 80s. So there are these really big inequities between owners of different properties, depending on when they purchased property, in terms of what they pay in property taxes. So there's potentially, I think, almost $20 billion that could be raised for localities. So counties, cities, school districts, and other special districts if we were to end that preferential treatment for commercial and industrial properties. So that would have to go through the ballot since it is a change to Prop 13. And it doesn't have a direct impact on state revenues because the property tax revenue all goes to localities, but it could take some pressure off the state budget in the sense that if property taxes for schools increase, that reduces the pressure on the state general funds to fund the Prop 98 guarantee. So great question.
Great. Thank you so much. Super helpful. I want to come back to you, Scott. Something that you mentioned up at the top of your presentation that the governor is proposing to temporarily set aside $10 billion this year, spend it next year. What's going on with that proposal? Can you walk us through that and sort of what are the trade-offs involved?
Yeah, what is going on with that? This is kind of an interesting one and a head scratcher for folks who haven't really been in the weeds on this, which I'm assuming a lot of people probably haven't, only because the governor is using this account that's pretty new. The state leaders created it a couple of years ago as a place to park revenues where they're thinking, oh, we're not actually sure these dollars are going to materialize, so we don't want to spend them yet. So we're going to put them in this special new holding account that we're going to create. And then if they do materialize, then we'll figure out what to do with them later within a year. And they hadn't used this new account up until now, but the governor is saying he wants to take $10 billion that is apparently, at least based on projections, coming into the state treasury, almost $10 billion, and shift it forward to the 27-28 fiscal year, which is not the one that's coming up, but the one that starts in July of next year. And so you can think of this as a short-term reserve, right? He can't keep the money in there forever. It's got like a 1-year expiration date. So they'll have to decide if they do this, what they would do with the money at that time. The main trade-offs here are, setting aside this money for 2027 would help to address the state's structural budget shortfall and make it somewhat less likely that cuts might be needed that year. But then, of course, on the other side, that means that these dollars aren't available for the 26-27 fiscal year that's coming up in just a few weeks, meaning those dollars aren't available for really critical services that we've been pointing out on this webinar that Californians really need right now. We have some urgent needs that are not going to be met. So that's the trade-off that policymakers are going to have to consider as they decide whether to adopt this proposal from the governor to shift $10 billion a year down the road.
Okay, thank you so much for walking through that so clearly. I'm going to come back to revenues here, Kayla. So one question we got was how many jobs are provided by the tax credits for corporations? And then also someone asked about, corporations leaving the state. I know you talked about that a little bit, but could you just reiterate that sort of, you have a resource to share on that?
Sure. So in terms of the jobs, it's a good question, and we don't have great answers depending on the program. So there are some tax credit programs like the California Competes tax credit program, which is relatively small. And the allocations are capped on an annual basis, and there's a competitive system where businesses get credits based on how many jobs they pledge to create, how much investment they make. And so there is some evidence that that's a little bit more effective in creating jobs than some other credits. But the bulk of revenues that we lose to tax credits are due to the research and development credit, which is uncapped. There's no application process, and there's never been any real evaluation of whether it's effective, what are the cost benefit analysis there. So I think we really need a close look at that program, since that's like up to $3 billion a year that we're losing to that credit. And some corporations are sitting on these huge piles of credits that they haven't been able to use yet. So it's unlikely that the credit is even providing much of an incentive to do research in the state. So it's a good question. These are difficult questions to answer because you need really well-designed studies to determine those things. But yeah, that's, I think, in addition to creating these annual caps on tax credits, we should really take a close look at the structure of these credits and whether they're actually effective. And then in terms of corporations leaving, I mentioned earlier that because of the way that the corporate tax is structured. There's really no tax benefit to a company moving its headquarters or its employees out of state. And especially when we're talking about tax policies that mostly impact these big national corporations, they're doing business everywhere already. And if they were to just give up their California market, there's really no economic reason for them to do that, to save a little bit on taxes. And there is some data that the Franchise Tax Board that administers taxes in the state looked at the tax returns of some big corporations who had announced that they were moving over the course of a few years, and found that most of them were only paying this $800 minimum tax before they announced leaving. So they really were not leaving to save taxes. And then a lot of those corporations ended up having larger tax bills after those announcements. So there's evidence that they're still operating in the state. They're still selling into the state. We're not really losing revenue from that kind of thing. So hopefully that's helpful.
So much, Kayla. You're a wealth of knowledge on all things tax and revenue. Appreciate that. I think we have time for one more quick question. And so coming to you, Scott, what is the timeline for when counties need to respond to the state budget revisions? What kind of discretion will counties be able to exercise as they are making decisions about health and social safety net programs?
Yeah, well, okay, great question. Counties are actually doing their budgets right now for the next fiscal year, just like the state is. And in June, they're going to be holding hearings across the state. Most counties, though, don't adopt their final budgets for the fiscal year until they're a couple months into the new fiscal year. So that's sort of August or September. And the reason they do that is because they're so dependent on state funding and federal funding that they need to see what happened in the state budget and then react to that as they enter the fiscal year. So you could think of the budgets they're going to do in June as kind of placeholder budgets. They're going to be happening while state leaders are doing their negotiations and before anyone really knows how things are going to shake out here in Sacramento. So unfortunately, if state leaders don't step up and provide counties the funding they need to shore up these critical programs that they oversee, they could be faced across California at the county level with some very challenging decisions in August and September and further into the fiscal year if they're realizing, there were a lot of needs here. We're really resource constrained. We're already facing, budget challenges of our own. The state isn't stepping up to help us. What are we going to have to cut locally in order to make space in our budgets in order to do the best we can to meet the needs of Californians who had the rug pulled out from under them by H.R. 1 and some of these state reductions? So counties are going to face really critical choices, and it could be happening as soon as later this summer if state leaders don't decide to make this a priority.
Yeah, absolutely. Absolutely. Just looking at the time, we're almost at time here, and we have a lot of other questions from you all. We are happy to follow up with you, but I'm going to close us out here. Really want to thank you all for being with us and engaging in this conversation. Also want to thank our event sponsors, Conrad and Hilton Foundation and the James Irvine Foundation, for making this webinar possible. And if you are able to support our work, please visit our website at calbudgetcenter.org/donate. Also, we know we shared a lot of information today. And so if you didn't catch everything, don't worry, we got you covered. Look out for our follow-up email with a recording. You can reach out to any of us with follow-up questions, particularly if we didn't get to your question today. We're happy to continue the conversation after this webinar. You can also check out our first look publication on our website to learn more about the issues that we discussed. Also want to point out that our website hosts a lot of essential resources on the budget, including our tax policy webpage with our tax policy glossary and 5 facts on California's tax system. We got lots of questions about taxes today, which is great. Please come check out our website and keep those questions coming for Kayla. For our Spanish-speaking audience, we have a number of resources on our website that I want to make sure to highlight. We have foundational budget and policy resources translated into Spanish, including our guide to the state budget process and a publication on how California policies are made. Also wanted to say, at the Budget Center, we are continuing our commitment to be in partnership with you to raise significant ongoing revenue that we know is necessary to create a California for all. And so if you are interested in engaging with us on this revenue work, please click on the link in the chat to fill out an interest form and we'll connect with you further. We got a really great question from you all today that we didn't get a chance to respond to about your perspective on how policy advocacy CBOs may need to shift in order to advance a policy agenda that addresses structural issues in tax and revenue. We would love to talk more with you about that. That is a fantastic question. So to end our time today, we would love to hear what your thoughts are on this webinar. Was it helpful? How can we do better? For our Spanish-speaking audience, please fill out the survey that popped up on your Zoom screen. And for our English-speaking audience, please take time to fill out the Zoom survey when the Zoom space closes. We really appreciate your feedback and we take it seriously. So just wanted to say thank you again for joining our event today. I hope you leave feeling resourced with information to support your work. And I really look forward to seeing you all at our next event. Thank you.